Since its inception, a core function of the Alberta Centre for Child, Family and Community Research has been knowledge mobilization and moving evidence into practice and supporting opportunities for researchers to share knowledge. Knowledge mobilization includes a variety of methods to transfer, translate, exchange, and broker research evidence to ensure that policy and practice decisions are based on solid evidence. A good example of knowledge mobilization, funded in part by the Centre, comes from Calgary's collaborative mental health care program.
I found that there was an enormous wealth of information and expertise out there that was incredibly useful to child welfare workers, but it had not made its way to the frontline practitioners. So it had not made its way to that frontline caseworker who had a baby on her caseload or was investigating an infant neglect case. He or she just wasn't getting that information. What we began to think about was, how can we take this science of early childhood development and translate it into materials and information and tools and training and all kinds of resources for all of the professionals who interact in the life of an infant or toddler who's been abused or neglected. And that's where I began thinking about developing some information briefs.
Evelyn and her colleagues spent several years immersed in the literature. With a group of collaborators, several articles were developed. But even the summaries were too long for the extremely busy frontline staff. And child welfare workers made it clear what their needs were.
All we want to know is, what do you want us to do? Give us something practical, usable, something that will tell me when I'm in a living room talking to a mom about her baby, what do you want me to do? And that's where I began, was to better understand what their needs were for information, what kind of information they need, and more importantly, how they needed it packaged so that they could actually make use of it.
The Alberta Centre for Child, Family and Community Research provided the group with a $15,000 grant, with a deliverable of 3 briefs focused on the emotional needs of infants and toddlers in care and brain development.
So those 3 briefs are now posted on the Centre of Excellence website and have been downloaded, as far as I know, approximately 10,000 times. And they've only been there for the last one appeared about a year ago. So all three, the first one was about 2 years ago and the last one about a year ago.
The briefs grabbed the attention of not only child welfare workers, but that of judges and lawyers. The Honourable Lynn Cook Stanhope, a provincial family court judge, wanted to learn more about Evelyn's research and invited her to speak at an Alberta Provincial Judges Association education session.
It takes a lot of time, uses up a lot of time to do those things, but we managed to include Evelyn because the focus of this year's program was domestic violence and its effects on children and brain development.
Judiciary members deemed Evelyn's research to be highly relevant to the cases they heard. Using information and presentations gathered from knowledge mobilization events, an electronic platform called Child in Mind was developed to disseminate research evidence to frontline service providers, members of the judiciary, and lawyers.
That's what you have to be hooked into, because I don't see any other way. People are too busy. They want quick information. They don't want to go and sit in a library and have 50 books come in. Besides, the books are out of relevance in no time.
Calgary lawyer Sonia Lucignol agrees that empirical evidence needs to be shared effectively with people working on the front lines.
Like, one of the big things that I think Evelyn, like on a macro level, has impressed upon us being members of the bar and the judiciary, is that decisions regarding children, especially infants, that's her specialty, should be based on scientific research. And we need to start looking at that research and applying it to what's going on with these children.
Sonia and her colleagues agree that in order for knowledge mobilization to affect policy and decisions, the evidence and information put before them must be in language they understand and applicable to their specific needs.
Like, I'm not an expert in infant mental health development at all. I'm I'm a lawyer. I'm trained to do legal research and to advocate for a client's position. But in this case, my client was a year and a half, so I didn't really know what position to take, and I wanted to take one that was based on evidence and based on what was in his best interest. So I think you do have to have some background knowledge. I think it's really important to have some background knowledge of those things that you mentioned, simply for the fact that you can then retain experts when you need to.
Effective knowledge mobilization requires building partnerships among researchers, policymakers, service providers, and involving champions who will help drive the change. The Alberta Centre for Child, Family and Community Research, along with its primary funder, Alberta Children and Youth Services, is proud to support knowledge mobilization projects in the province and looks forward to its continued growth.